All right. So, hello to all the viewers. I'm Dr. Rahul Rajeev, Medicine Faculty at DocTutorials. So, the July FMG results have just been announced, and it's my proud privilege to have Dr. Prajol Raut, who has scored an amazing score of 200. Mind you, this was a very difficult exam comparing the level of questions. So, to get a score of 200 in such an exam and to pass with such flying colors, Prajol, congratulations, first of all.
Thank you so much, sir. Thank you so much.
So, Prajol, first of all, let me ask you, how is that feeling? Such an exam, slightly difficult paper. How do you feel right now?
I am absolutely elated because when the results were announced in the afternoon, I think my heart was literally in my mouth because I was expecting to pass, yes, but with such a good score, certainly not. Yeah, it was a tricky exam, certainly yes, but pretty much doable exam. I feel
Okay.
because the questions, as I said, it always gives you the hints. It's just that you have to practice such questions. You have to be thorough with how you read the questions, how you adapt to those questions. So it's very important to solve those long questions. So question solving is a very important strategy that helped me in this FMG exam.
Right. So, very useful insights. And Prajol, let me start with this question. So, this time you can see the overall pass percentage is on the lower side. So, students preparing for the next exam will want to hear from you on your method of preparation. I'll start off with this. Prajol, what was your method of preparation? Were you relying on, say, certain revision videos and previous year questions alone, or was it like you studied in a proper systematic manner? What was your method?
As I always say, sir, that the preparation for FMG never happens in the last 4 5 months. It always is a process of 5 years. When you are in your med school, it is very important to be thorough with the concepts and how you. There are certain things in the total MBBS life that you have to remember those things. So that remembrance part comes from the rapid revisions, but the conceptual part always comes from the main videos, right? And the of course the standard books that you use in your MBBS life. And yes, being thorough with the concepts is very important, especially in clinical subjects like medicine, be it gynae, be it surgery, OBGY. And it is the conceptual understanding is very important before you jump to your rapid revisions. So yeah.
Yeah, I think that is a very important point that you just shared with us because even after the results, many students messaged me that, sir, for those who could not pass, they told me that, sir, we were relying mainly on shortcut videos, shortcut sessions alone. So they thought that, that would actually get them across the 150 mark. But as you can see, the FMG exam has evolved over the last several years, and my personal take is also that just by mugging up certain shortcut notes alone will not do. You have to learn the corresponding subject from the subject expert. As Dr. Prajol said, learn it in a conceptual manner. Otherwise, what can happen is when the question is slightly twisted, you end up getting it wrong. Only if they ask you the direct factual question, you will get it right. So, Prajol, that is what you were trying to convey, right? On going
Absolutely,
in
sir.
a conceptual manner. Right.
Absolutely,
That
sir.
is, yeah, that is how Prajol actually prepared as well in a proper conceptual manner. So Prajol, you are actually from just take us through your college and also which place are you from?
Yeah, so I'm from Maharashtra. I'm from Navi Mumbai. And the MBBS life that I had for 5.5 years, it was quite smooth, to be frank. Being concise, be thorough, and be disciplined. Being disciplined is very important to your 5 years. And the in initial 5 years, usually we should focus on not only just passing the institution exams, but also, as I have always said, that building your concepts. Know the subject first. It's very important. Just know the topic very well. Don't just start mugging up things, right? You should never mug up the things. The first time when you go through the subject, it's always understanding the subjects. The second time you go through the subjects, you try to identify those points which are very important. And third time when you go to subjects, it's the learning up all the things that you forget and are very commonly asked. So yeah,
Okay.
so that's how you should orthodoxly prepare for the FMG exam, or I feel any exam you should prepare in that way. As
You
far
were
as
from which university? Which university?
I was from New Vision University from Tbilisi, Georgia.
Okay, right. Okay, right.
I passed out in January this year.
Okay, right. Now, coming to your journey with DocTutorials, so so just let me take you through these important subjects right from the basic subject, say in first year, like anatomy, physiology. So in anatomy, which lectures did you follow? DocTutorials.
Dr. Azam lectures from anatomy, I think they are, I feel they're gold standard. Like, I mean, every single FMG student has to follow that. I mean, his lectures, his notes, they're very crisp, very concise, and very focused, to be frank. Easy to understand, certainly, yes. And the first time I feel that we should always go through his main videos.
Okay.
For example, every section he has beautifully explained, be it the head and neck, be it the upper limb, lower limb, be it the abdomen part, the pelvic part. He has very crisply and concisely explained every single part. So go through the main videos, I feel, and then go to the rapid section of his. It's also amazing.
Yeah. So basically, what you're trying to tell us is that you first went through the main videos in the DocTutorials app,
Yeah.
anatomy section,
Yes.
and you made your notes. And once you got a good conceptual understanding, you also went through his revision notes, which actually helped you better consolidate your knowledge of anatomy, right?
Absolutely. Absolutely. So.
And also, like I know that Dr. Asam shows a lot of images in his class. So did those images give you a better visualization of anatomy? Because I always feel anatomy is a visual subject.
Absolutely. So yeah, I mean, when you talk about anatomy this year as well, we had literally an image of a cadaver, right?
Okay.
So in his main sections, he has explained beautifully of how you should visualize the image thoroughly. First, identify the structures, then go on to marking it. Just identify what exactly it is, what part it is, then just visualize yourself in the head what exactly it is, and then start seeing things, like. So yeah, that is how he makes us understand, and he's very funny at times, yes, certainly,
Mhm.
and we enjoy his lectures a lot.
Right. Great, great. And coming to physiology, did you follow
Yeah, so
Dr. Physiology as well?
so physiology, I was struggling a bit with other preparation platforms, because I was not able to have that concise understanding of it. Then I decided to stick to one platform. It's very important, rather than jumping from one to other. So yes, I stick to the platform of DocTutorials of physiology, and it helped at very much extent, because the physiology nowadays, it's not asked in a particular, just a single physiology aspect, right? It gets combined with medicine, it's combined with path, it's combined with many different subjects. So that's how they ask it.
Okay.
So yeah,
Right.
mostly it's combined with medicine most of the times in
Right.
the FMG exams.
Okay. Right. So coming to ENT, so how was ENT in DocTutorials?
I think again, similar thing with ENT. I was struggling with ENT from different aspects, because ENT, you have to be thorough with the head and neck pathology very well, right? So anatomy, sorry, very well. So to have that conceptual understanding of what you should first know of that anatomy, I think Dr. Rajiv Dhawan was very helpful in that. And yes, his basic understanding of the subject, that first understand the subject and then try to learn the subject, right? I
Okay.
think that is very helpful from his perspective. So yeah.
Okay, right. So, and also like the sessions that Dr. Ajay Dhawan sir has conducted throughout the course of your preparation, those motivational sessions and all. So, did that actually help you stay focused?
Yes, very much, sir. He is always, the way he deals with the FMG students is very amazing, because, we FMG students, we are worried initially, yes, because we are not used to this Indian style of examination, but he takes us through them very easily, and he motivates us. I mean, the first thing you should have in this FMG exam is motivation. Right? You should be motivated that yes, I will pass. I will pass this exam. It is an exam made by human being and has to be passed by human being only, right? So yeah, I mean, it's doable, very much doable job of FMG. It's just that you have to be focused. I mean, this is the very important phase of our time. To be harsh, to be harsh on myself, I always used to say that yes, you have 5 years you have studied, but remember one thing: you are a 12th pass guy, right? You have to first clear the FMG exam to call yourself as a doctor. Although nothing to be taken away from anyone, the knowledge always stays there. It goes nowhere. But it's the fact that you have to pass this obstacle. For 5 years, we work hard. You have to pass this obstacle at any cost. So yeah.
Right. So basically, whatever words you have actually shared will be definitely useful for the future aspirants. And from my side, what I want to tell the upcoming exam appearing students is that you please do not stick on to shortcut revision material. Just like as Dr. Prajol said, learn each subject from the subject experts, and only towards the end you go for revision videos, and that too just like Dr. Prajol did. He learned anatomy from Dr. Asam. He relied on the revision videos of Dr. Asam. So he tried to stick on to one platform rather than going for too much content. This is what I want to tell all dear students. And also, it's very important to practice MCQs. Prajol, I've always noticed, I've seen many talented FMG students, they put in so much of effort, but when it comes to MCQ solving, they are having some sort of difficulty, which is why, even the DocTutorials team, the faculty, and as well as the management, what we have decided is that this time leading on to the December FMG exam, in addition to the videos that we have, we are going to conduct some test and discussion sessions, Prajol, MCQ discussions live, because now we have got the DocTutorials live app as well, which is a live interface. So I think we'll do some test and discussion. So what is your take on that? Like the utility of test and discussions, which will help students consolidate the content better.
Yes, I have been giving the grant tests of another platforms, but test and discussion is a very important thing to be done after every single grant test. Why I
Okay.
say that? Because just by giving grant test and skipping that part, it's not good. Why? Because you will be again making the similar mistakes in the next tests. You
Correct.
have to first realize that you should not be making that mistake again. We have made that mistake now, fine, no problem. It's just the preparation thing, and try not to make that mistake again. So yes, test and discussions are very helpful platform, and especially I think it's very important to identify where exactly how exactly is the pattern of the exam. And I think that comes with solving many MCQs, especially of the 5 years past 5 years FMJ exams MCQ. And
Yeah.
the misconception that the PYQs are never repeated is actually not true, because PYQs as it is are never repeated in the FMG exams. It's the topic that has been repeated in the FMG exams. It's the entire content that you should be thorough with to solve that similar PYQ, because it won't be asked in the similar fashion every single time, every single
Right.
FMG.
Got it. Got it. So I think, Prajol, I'm also very happy to see the clarity that you had in your preparation, because in the short time that I've interacted with you, you seem to have a good clarity on how your preparation should proceed. And it seems that your planning was in the proper manner. And it goes to show that the score that you have under your name, 200, is just a reflection of the amount of effort and dedication that you have put in. And I really wish you all success in your future, and God bless you, and thanks a lot for joining.
Thank you so much, sir. Thank you so much.